Okay. All right. Good morning, everyone, and thank you for being here today. This is the breakout session on cardiopulmonary diseases and heat and extreme temperatures. I think it would be helpful, given the size of the room, if we can have maybe some folk kind of move a little bit closer. We want to make sure that we can see you and ask any questions along the talks. As I mentioned earlier, I'm Luis Castellanos. I'm a cardiologist by training, but my passion is really medical education and working with medical students. I'll be giving the first talk about 25 minutes, and the second talk will be by my colleague, Dr. Jacob Bailey. He's a pulmonologist, critical care specialist here at UC San Diego, and he'll be able to talk to us about some of his experiences. All right, well, thank you again. I wanted to start by highlighting that I don't have any financial conflicts with regards to the material I'm going to present, but I do have a very strong passion for nature and our environment. In fact, right before this, the summit here, I took my kids, my family up to Yosemite. I mentioned that to some of you earlier. And I took this picture about 10 minutes before reaching the valley in Yosemite. And it really kind of put things into perspective as I took my younger kids, ages 7, 9, and 11, for the first time to see Yosemite Park. And here you could actually see some of the beautiful sections of the park. You see at the very far end, you could see Half Dome. And on my right, you could see Vernon Falls and El Capitan on the left. All right. This is what I hope that over the next 25 minutes we can actually discuss, and you guys can learn throughout the talk, and that is we'll talk about cardiovascular diseases and how it affects heat and heat waves. I also want to discuss how heat and air pollution, as Dr. Wooden mentioned, fine particulate matter works synergistically to increase the rates of cardiovascular diseases. I also want to discuss how heat and heat waves affects disproportionately different groups, in particular the vulnerable populations. And finally, I want to describe solutions. What can we do to mitigate the effects of heat and heat waves as it affects individuals who have cardiovascular illnesses? This is the outline of the presentation. We'll talk about cardiovascular diseases, the global impact, experiences in the state, as well as regionally, locally, and finally talk about vulnerable groups and solutions, what we can do. We've all seen, I think, over the last couple of months, satellite images throughout the world of extreme temperatures, whether it's here in the US and North America or in other parts of the world. We've seen that ocean temperatures have gone up, as well as the highest numbers of consecutive days with record temperatures. And as you'd expect, the South and Southwest are more drastically affected. In fact, when you look at other regions, such as Europe, this is a snapshot that I took of one of the news feeds that I received. In fact, you can see that Italy and other areas in Europe, they're greatly affected by extreme temperatures. It is not just heat and heat waves, but also shifting of other natural disasters. We talked about flooding and smoke from fine particulate matter. In fact, most recently, my heart goes out to our sisters and brothers up in Hawaii. They've been affected by the wildfire out there, and that dozens and dozens of individuals have been killed and or displaced from a catastrophe of events. And in fact, you look more to the region, and this is a news feed from Arizona. In fact, Phoenix has been having the highest number of consecutive days with 110 degrees Fahrenheit or higher. And in fact, when I took this, as I was presenting my slides back in mid-July, that was 19 consecutive days. And I believe now they're up to greater than 40 days. So as you can see, it is something that is affecting a great deal of our community members. Now, let's talk about the why cardiovascular diseases is something important. Why is it that we should care about this? Well, when you look at the demographics in terms of mortality from cardiovascular diseases, you actually see that's the highest number when it compares to other diseases, right? It's higher than cancer, it's higher than other diseases that affects the renal system, for example. So you can see here in this particular bar graph, when you took all ages combined, when you put cardiovascular diseases, that is diseases of the heart as well as stroke, which is a vascular disease, you have the highest incidence of death. Now, when you break it up based on age, those individuals younger than 85 or those individuals older than 85, still cardiovascular diseases gives the highest number of mortality. Now, here in the US, approximately 80 American adults suffer from cardiovascular diseases. And we're talking about diseases of the heart, heart failure, hypertension, stroke, as well as peripheral vascular disease. And when you can see in the pie chart here that approximately 43% of those who die from cardiovascular diseases end up being diseases of the heart. That is, individuals who suffer an acute myocardial infarction or heart attack. But you also have individuals who suffer strokes. In the case of embolic or cardioembolic strokes, heart failure, or peripheral arterial disease, or other congenital abnormalities of the heart. Now, it's important to talk about the climate drivers and how that relates to heat and air pollution in the case of fine particulate matter. Also, the comorbidities or the other illnesses, we see that there's a high proportion of Americans that have diabetes, they have hypertension, they have renal disease, and all those play a part. So those are individuals are higher risk of experiencing cardiovascular illnesses. And then you combine that with social as well as environmental factors and how can actually increase the rates of morbidity and mortality of the members in that community. And that specifically has an effect with the vulnerable populations. So in fact, when you get all these factors, right, when you get the climate drivers, when you get the social and environmental factors, when you combine those with institutional elements of it, and on top of that, you add this extreme high temperatures that are consecutive, it ends up leading to bad outcomes. Now, not everyone is affected the same way, so it's important to look at those populations that are higher risk of experiencing these bad outcomes. In fact, in this particular article, it's an article that I ended up reviewing with my students, and what they ended up doing, they did a literature search of over 7,000 pieces of literature, and they summed it up to do a meta-analysis of 260 articles, and they saw that when you have a 1 degree increase, that is degrees Celsius, you see an increase in mortality from cardiovascular diseases. We talked about approximately a 2.1% increase. That may not seem like a lot, but when you talk about populations and in terms of 1 degree of ambient temperature increase, it can be quite significant. Now, that was mortality. It's also important to recognize that morbidities, it also goes up. So we're talking about hospital admissions and other factors, as Dr. Wood mentioned. So, and also when you see a 1 degree Celsius increase, you also see highest rates of hospital admissions for cardiac arrhythmias, cardiac arrest, as well as other illnesses. Now, as I alluded earlier, not everyone is affected the same. In fact, older populations, those individuals that are older than the age of 65 tend to be affected, as well as women tend to have a higher rates of hospital admissions and morbidities, individuals that live in tropical environments, and individuals who have a lower income. This is, I apologize for the busy slide here, but you could see here, I highlighted it with the red rectangle, you see that on the forest plot, that a lot of the factors that I mentioned kind of leaning to the highest rates of morbidity and mortality, you can see that the highest driver is lower income individuals. And that's followed by women, individuals who live in the other environments. Now, in morbidity, not everyone is affected the same, but you also see that arrhythmias, cardiac arrest in individuals from lower income, which is right here on the lower section, see, tends to be more dramatically affected. Now, the other piece of information that I wanted to present dealt with the hospital admissions rates. And you can see that, again, this is a large study of approximately 28 million Americans, older Americans above the age of 65. This is a Medicare population. Now, what they ended up doing, they ended up looking at administrative data and looking at individuals who ended up getting hospitalized during an episode of a heat wave of extreme temperature. And they collected that data and plotted out based on the US map census. And you can see here that the large areas, urban areas, have been well represented. It's important to highlight that we don't have as good information for rural communities. And that is marked here by the gray sections. So again, you got to look at the data carefully. Now, when you look at the urban centers, you could see that there's the highest rates of hospital admissions for fluid and electrolyte disturbances, as Dr. Wood mentioned in some of her slides. It's also important to highlight there's the highest admissions for heat stroke and heat-related comorbidities. And presumably this is because they're losing a lot of fluid throughout the number of exposure to the heat temperatures. Now, the way that the study was performed was actually done quite well. And what I wanted to highlight is that they looked at not only the increase in temperature, the ambient temperature, but they also looked at the exposure, how long you actually were spending on high temperatures. That is, whether or not the individual was exposed to high temperatures for 2 days, for 3 days, for 4 days, consecutive days, and also whether or not the temperature was actually higher, that is, the 99th percentile above the average temperature for that particular area. And as you would expect, the longer the exposure to higher temperatures and the higher the temperature, you were more likely to go to the hospital and get admitted. This obviously has the implications that when you get hospitalized, then there's a higher burden cost to society, to the individual in general, as well as morbidity and mortality effects. Now, it's also really important to highlight the elements of fine particulate matter in the relationship to myocardial infarction. We've known for decades that fine particulate matter, that is smaller particles that are less than 2.5 microns, tends to have a higher incidence of experiencing a cardiovascular event or myocardial infarction. That's been well documented. Now, what we actually are beginning to learn is that when you combine that with high temperatures, it synergistically increases the rates of cardiovascular events, that is myocardial infarcts and other comorbidities. And in this particular study that was, it came out of actually China, what they ended up looking at is the heat exposure to the fine particulate matter over a period of 5 years. It was a time stratified crossover study of over 200,000 individuals. And what they showed here with this particular graph here, and you can see that the odds ratio, as you increase the number of days over time that you get exposed to high temperatures, that meant that you had a higher probability of actually having a mortality related to cardiovascular disease. And as I alluded before, there's certain individual groups that are more likely to experience a bad outcome, and that is women as well as older adults, those above the age of 65. And again, the synergy between heat and fine particulate matter, it can lead to an increase in cardiovascular death. Now let's talk about the experiences here in the US, in particular, California. I actually wanted to bring an example that is close to home, figuratively and literally. We talk about the Salton Sea. This is a body of water that I normally see when I travel to Imperial County. I go to Imperial County about once a month or so. I cut back on my travel there. And this is a inland lake that was produced by the flow from the Colorado River many centuries ago. However, now with the development of dams, it doesn't really have much of inflow from the Colorado River. So nowadays it's mostly stagnant, and it relies on runoff from agricultural areas. So it's actually polluted from fertilizers and pesticides and different just water that just runs into the river. It overlaps two of our counties, Riverside County as well as Imperial County. As you can see, it's east of us, so it's actually exposed to high temperatures. Now, one of the reason I wanted to mention that is because if you look at the news and literature surrounding the Salton Sea, is actually the lake has been shrinking. It doesn't have enough water going to it. So what does that mean? It means that you have less water around it, so more particular fine particulate matter is being exposed to in the environment. And the high winds are picking that up and taking it to the community nearby. So as you can see here, for example, what the authors ended up plotting here on the dark line here, that over time from 1998 until 2014, you see actually a decrease in the elevation of the Salton Sea. And at the same time, you see actually an increase with the gray bars here. You can actually see an increase in the fine particulate matter that you see in the environment surrounding the Salton Sea. So what does that, how does that relate to everything? Well, again, higher concentrations of fine particulate matter in the air, so more pollution, and it affects actually the population. Now, one of the things I want to highlight before I go to the next slide is that you can actually make some changes. So as you can see here in 2005, there's actually a decrease in fine particulate matter. And that was because that particular year was a relatively wet year, and there was more water going to the Salton Sea. So it's actually, there was an increase in the size of the lake, and therefore that had a direct relationship to a decrease in the fine particulate matter in the air. Well, that's important because for 1 foot drop in lake elevation, there's a 2.6% increase in the fine particulate matter in the air. And as it shows right here, that actually leads to an increase in respiratory mortalities in the area. And that obviously has an implications to the local economy for the individuals surrounding the area, because they tend to have higher rates of readmission to the hospital with cardiopulmonary diseases, as well as mortality. We talked about global events. We talked about national in California and our region. It's also important to talk about vulnerable groups and what can we do to mitigate these effects. Now, we know that there's certain groups that tend to be more affected than others. I already highlighted some of them, such as the elderly. It's also important to mention that children and individuals from low-income communities, as I highlighted, those who tend to be lower income, less likely to afford air conditioner. And that is really important. Dr. Witten mentioned that. And I can tell you that based on my experiences going to the Imperial County, without missing a beat, every year during the summer months, I get a call from the ER to see a patient with elevated cardiac enzymes. When I go and speak with a person, I hear that they were in their house and they experienced the long spell of high temperatures, right? As you guys know, Brawley or El Centro get temperatures in the 115s, 118s temperature. As you can imagine, those individuals, they need to be in cool zones or have air conditioner. Many of them don't. Many of them, they tell me that they grew up in the area, born and raised in the area, and they can handle the heat. But what they don't realize is that maybe they could handle the heat when they were younger, but as they get older, they're more likely to experience events. So I see these patients come into the ER with a heat stroke or heat-related illness, and it ends up leading to a myocardial injury. So the older populations are certainly a risk. It's also important to highlight that the homeless population are at risk. As it was mentioned, here we don't have the green spaces, the canopy that kind of protect some other individuals on the street. So homeless, we always need to think about that, and we see that often in Hillcrest Medical Center when they bring them in to get resuscitated with electrolytes and IV lines. And then finally, populations that are high-risk jobs. We talked about those individuals who work in the agricultural field, right? As we mentioned, Imperial County, certain areas of San Diego where you have individuals working out in the fields, they're certainly exposed to that. And construction workers who are fixing the roads or building houses or agricultural areas, building new equipment. Let's talk about actionable solutions. What can we do? Well, definitely cool zones. It's important to highlight to individuals, to talk about green spaces, the control of air pollution, in particular fine particulate matter, and that has a direct relationship to how can we actually keep those fine particles in the ground so they're not up in the air and people are not breathing them in. So it's important to educate the public, the government, to do advocacy both at a regional, state level, at a national level, so that we can actually make an impact in our communities. And finally, the reduction in greenhouse emissions by electrifying many of our homes, putting solar panels, that can be important. Now, I know that some of the other talks will talk about cool zones, but I wanted to at least mention that it's available to many individuals. They just need to take advantage of these cool zones, and that's typically involves going to a local library or a recreational center, or it could be a community center as well. And there's available for individuals, and usually during the hottest temperatures, you can go in there and spend some time. They usually have Wi-Fi as well, so you can kind of get your work done. It's also important to highlight that we want to actually protect our green spaces. We want to protect our forests, our oceans, and our beaches, because those are areas we can actually go and actually get some relief from the heat. Actionable solutions, in particular to our patients, to our siblings, to our individuals who live in our communities. Make sure that you increase your fluid intake. Even though you may not necessarily feel like you're thirsty, it's important to stay hydrated during these temperatures when they're elevated. It's also just be cognizant that when there's individuals that that are high risk for developing a heat-related illness, to actually stay indoors. Sometimes it can be challenging, especially if you live in areas that are more central to the state. But again, be cognizant of those things. We should emphasize the reduction in exercise. And I know that may sound weird for cardiologists to be saying that, but especially during hot temperatures, it's important to not stress yourself. I can tell you that a few weeks ago, actually, we took care of a patient in the hospital who came actually with a heat stroke because he was running 6 miles nonstop in North County. And he thought that because he was young, he could deal with the heat, but he actually came in with a heat stroke. It's important to adjust your cardiovascular medications. Many of our patients are taking diuretics or ACE inhibitors or angiotensin receptor blockers. All these medications work on the vascular system and the kidneys, and you lose many of your electrolytes when you take these medications. And obviously during a heat wave, you don't want to get dehydrated. It's important to maintain all the fluid that you can. So it's important to adjust the medications if you're going to experience high temperatures. And also, it's really important to understand that the largest mortality effects occurs when you have the highest temperature of the day of exposure, but also continuing up to 3 days from the day of the exposure. People think that, yeah, just because yesterday was hot, I'm good. No, it takes a while for your body to get used to it and to actually get back to a normal state. Otherwise, the vascular system, the kidney system will begin to feel it. So be aware of those things. Now, none of this work would have been possible without the support of our students, our administrators, our colleagues here. So again, I want to give thanks to Jesse, who's here in the audience. Eileen couldn't be here. Both of them are medical students, part of the PRIME program. Also, Valita Jones, who are administrator, Rosie, who are coordinator, Jacob Bailey, one of our assistant professors and assistant director for PRIME, and obviously Sed, who's been helping us manage the conference. And with that, I'll leave you with one of my favorite quotes that I enjoyed reading the books of Dr. Geisel and Dr. Seuss, that unless someone like you cares a whole awful lot, nothing's going to get better. It's not. Thank you very much.
I like to joke around. So, hi, everybody. My name is Jacob Bailey. I'm an assistant professor here in the Division of Pulmonary and Critical Care Medicine, the assistant director for Prime Health Equity. So, as a pulmonologist, I like to joke around that. So, pulm crit doctors are like the lungs themselves. We're resilient. We like to take care of others, and we're pretty unselfish. So, I'm going to kind of whiz through my slides to make sure that we stay on track for SED and the other presenters. And looking out at the audience, I gotta tell you, I think I woefully underprepared in the sense of, I was thinking that there would be a lot less expertise inside of the audience than what there actually is. So for many of you, this is gonna be just review. And on top of that, my colleague did an amazing job by showing how resilient the lungs are and not quite the heart. I'm just joking. So every time I start a talk, I always pay a little homage to my father, who worked in aerospace. This is a picture from the James Webb Telescope of the birth of a sun-like star. So imagine the heat that thing gives off. I also have no financial interests. I am going to talk, but I have no financial interest, but there is the elephant in the room, is that every single one of us has our own experiences, our own biases that are born by our own socio-cultural positioning and the experiences that we've had in life. And this talk is no different. And that's because I grew up here in Los Angeles, in the harbor area, near the port, surrounded by oil refineries and shipping yards. So the concept that heat, that interplay of heat and pollution makes a difference, it did not take me to go to medical school to figure that out. I mean, in the summer, it stinks around the port. It really does. It smells horrible. It wasn't any surprise when I later learned sort of the scientific basis around this fact. It wasn't a revelation. It was one of those no-duh moments. And it shows in the asthma rates and the asthma hospitalizations and ED visits in Los Angeles, with the vast majority being centered around the port and a couple of other areas up north in the valley that has to do with the industrial zones throughout Los Angeles County, and hint, the wealth distribution. As many people have already shown, we've seen the increase in mortality associated with heat waves and increased heat. There was this study that was done at 9 different European cities, just showing the increase in the daily mortality that was associated with heat waves during a period of over 12 years. And it was really interesting because it ranges all the way from 4% over there, and this one was in Munich, all the way to a 92.5% increase in daily mortality in Milan, Italy. So there's really something to this about the environment, the interplay, the adaptive approaches that our societies, our neighborhoods, our communities have made, and the impact that it has on our health and our ability to be able to take extreme heat. This was a meta-analysis of over 100 of these studies over here, super busy, mainly just to show that for the lungs, unlike the heart, where there's a big increase in morbidity and mortality with extreme heat, the lungs a little more resilient. It shouldn't be surprised because air isn't sterile, and the lungs are the one internal organ that is on a continuous basis in contact with the external environment with every single breath we take. Which means it has to be resilient, but at the same time, it also means that it's the port of entry for the rest of the body, for all of the pollutants and everything else. What this slide doesn't show is that this particular meta-analysis probably underestimates the impact of heat on respiratory morbidity and mortality. There were well over 180 articles that they did not include in their analysis because those 180 associated increases in morbidity and mortality with single-day spikes in heat. And the reason why that's important is because when you actually look at the impact of heat on respiratory health, yes, there is an effect and it does happen over time, but the vast majority of that risk is at that same day. It doesn't take much time in order to be able to have a negative impact on your respiratory health. So although they found small associations here, like I said, probably woefully underestimated. How does it happen? Increase in pollen counts. We know that the warmer the environment, the more pollen is in the air, the longer the growth season of plants, the greater the increase of wildfires, which we here in California experience all the time, but unfortunately, as Dr. Castellanos mentioned, our families in Hawaii are experiencing right now. Heat generates ozone. And you might think, okay, well, don't we want an ozone layer? Sure, but ozone where we're breathing it in is not what we want. As a matter of fact, it's quite toxic to us. It increases desertification. Try to say that one 5 times fast. Increasing the size of our deserts, making places that probably had some local flora less so. And then, of course, the increase in anthropogenic pollution, mainly through fossil fuels, and in part to make us all chilly here in this room. Do we all need to be wearing jackets right now? Probably not. A lot has been talked about PMs, particulate matters at 10 and 2.5 microns, or less than 10 and less than 2.5 microns. The reason out of curiosity, do people know why the 2.5 is so important? Close. So 2.5 is more, it's just a little bit bigger than the average bacteria, and it's small enough that it can get into every single part of the respiratory tree and cross over into circulation and translocate. So close, very, very close. The lungs have a phenomenal way of cleaning themselves out with a mucociliary clearance system. right? We have an entire sort of fly trap coating the inside of our lungs and little microscopic hairs that help sweep all the crap out. But 2.5, but it relies on having big things get, because of turbulence, land on the fly trap. 2.5 is small enough that it gets down into the really deep areas and can actually translocate before it gets swept out. Hence the port of entry. Just a couple of years ago in the New England Journal, this group, they looked at well over 400 sites across the globe looking at particulate matter concentrations. And what they found was increase in the total percent change in mortality, both in cardiovascular as well as respiratory disease across all of these countries here. What was particularly interesting and also kind of scary is that, so here, this a 10 microgram increase in microgram per meter square increase in PM 2.5 was associated with this increase in mortality in all of these different spaces, or all of these different locations. Okay. But here's the scary thing is that when you look at this graph, 10, I wish I had a, let's see, does this, can you guys see the little green dot okay? 10 micrograms per meter squared is just this over here. That's a very small increase for a demonstrable change in daily percent mortality. And on top of that, when you look at large national and international guidelines, these are the thresholds that they actually recommend over here, 25, 50, here in the WHO and the China Air Quality, all the way up to 75. And there's no real sort of, I mean, it may be a small plateau, but it's still increasing. So no matter how high you go, there's going to be an increase there's an increased percentage in mortality. But it's, I mean, I know one of our plenary speakers talked about, that adaptation isn't enough, and I wholeheartedly agree with it. I do find it interesting, though, how well we have been able to adapt to live across the globe, right? So this is a group that published in the Lancet, looking at various different cities in all of these different countries, and they introduced something called the minimum mortality temperature. This is the temperature at which you have the least amount of effective temperature on mortality rates, right? So you go too cold, mortality goes up. You go too hot, mortality goes up. So where's the sort of sweet spot? Where's, the sort of Goldilocks and the Three Bears? Where's the sweet spot? And it ranges from country to country. Why? Because not only do we adapt, but we adapt our surroundings to where we live. Good thing, but again, insufficient. We do it through various different mechanisms, right? Our social practices, air conditioning, canopy, lots of different ways. But as already been mentioned, not everybody has the same benefit, right? So you could take these same maps and look at canopy. You could look at these same maps and look at other sort of the social safety net. You would see very similar things, that you have pockets of areas where people do not have access to the very interventions that are meant to be able to decrease their risk of these negative effects, right? And it's exactly what we would think. It's based on these, on socioeconomic status, race, ethnicity, wealth, education, right? There are things that we can do at the individual level. It's not going to be necessarily enough, but if we want to just think about ourselves, well, the higher your body fat content, the more heat you generate. So if you want to stay cool, your own health does take into it, does play a role. And interestingly, and on top of that, the amount of heat you generate while doing work also increases with body mass. So this actually is just came out. It's not even in print. It's only online in Chest, and it's ways in which we could potentially make a change or a difference. And I'm going to leave this up here for everybody because I want to make sure that we stay on time. But it's really these interactions, right? It's not something that we as physicians can do. It's not just things that we as patients can do. It's not just how the healthcare systems run, but it's these intersections, right? I'm all about intersectionality. I'm all about the way that the interplay. There actually is quite a bit that we can do to make an impact. I only hope that it'll be enough. So, again, showing the adaptability of us across the globe. Thanks, everybody, for being here. I am in awe of all of you and your commitment and your interest in this. The number of people that were willing to come to an auditorium on a Saturday to talk about, quite frankly, a very disturbing when you think about it on the large scale, right? But this is, to me, very awe-inspiring that so many people, such as so many individuals such as yourselves, would be here. Thanks to said Dr. V. Nguyen for organizing all of this. My colleague, Dr. Castellanos, Dr. Jones, Rosie, and Jesse, and Eileen. Any questions?
Thank you so much, Dr. Bailey.